Good morning. So I'm going to take you to a very different direction. So often in clinic, you'll get patients ask, what can I do? So here are some evidence-based approach from integrative medicine. So in large national survey study of cancer survivors, we found that 6 out of 10 cancer survivors use a type of complementary and alternative medicine, meaning herbs, supplements, acupuncture, massage, so on and so forth. And 4 out of 10 have used in the last 12 months. And when compared with people without cancer, most of the patients use because traditional conventional medications do not help, or they are referred by their families or even healthcare providers. So the unmet patient needs combined with sort of desire to serve patients from academic cancer centers have fueled this field called integrative oncology. Actually was born here at Memorial Sloan Kettering Cancer Center. You all know Andrew Vicker as a great prostate researcher, but he's also very known in the field of integrative medicine. So what can I do when a patient asks you? I really like this quote from Bill Gates. When we want to improve lives, you've got to deal with more basic things. So here are the key basic things that really affect a patient's life. Diet and nutrition, physical activity, mind-body therapies. Certainly a lot of patients come from different traditions, have different families, by supplements and herbs. So today, my brief talk will emphasize healthy food over supplements, a more plant-based diet and Mediterranean diet, and review some of the evidence for physical activity, and some of the emerging evidence in the area of mind-body treatments for cancer symptoms, but last but not least, to really get to understand a little bit what's the benefits and harms for supplements and herbs. So the evidence for physical activities for prostate cancer is pretty well established, especially in the setting of sort of an early stage prostate cancer. We really need to view those men or just as men with prostate cancer rather than prostate cancer survivor. So mounting evidence demonstrate that physical activity can increase the aerobic activities, muscle strength, balance of physical functions, decrease pain and fatigue levels. And in terms of diet, we generally recommend patients to go with more of a plant-based diets rich in fatty fishes and not limit the amount of sort of red meat intake. And some people are really, when diagnosed with cancer, go into this crisis mode, want to change their entire being. And I often tell patients, if you want to go vegetarian, that's fine. We just need to make sure your nutrient intake is adequate. But there's really no necessarily evidence to show complete vegetarian diet is more beneficial than a Mediterranean diet. And there's much more evidence in both the general literature and cancer-related literature to show Mediterranean diet is probably one of the best diets for cancer survivors. And just recently, there's a paper published in the International Journal of Radiation Oncology Biology and Physics done by colleagues at UPenn when I was at UPenn 2 years ago. So they actually randomized a group of men with prostate cancer to yoga versus usual care during radiation treatment, found that practicing yoga have improved their fatigue and as well as urinary sector dysfunction. I was very skeptical about the study when the PI approached me for mentoring in conducting this trial. I said, man, yoga? But it turned out with a motivated yoga instructor who is just happened to be a wife of the radiation oncologist who treat prostate cancer, and also Dr. Vapavali from UPenn, who is really very believing in quality of life improvement. The trial not only accrued but also showed a lot of benefit. And the evidence of yoga is actually very strong in a lot of the cancer survivor study, mostly done in women with breast cancer, show improved sort of fatigue, hot flashes, and functions, lung capacity, and sleep. And another area of the research is called the mindfulness-based stress reduction. And again, this is a type of intervention really cultivating sort of a mindfulness approach, acceptance-based sort of approach to deal with life crisis, and pay attention to bodily sensation and focus more on the present rather than the future. And again, a lot of the studies are done in breast cancer or mixed populations, but there is a recent trial published in patient with prostate cancer in active surveillance showing that this MBSR approach has improved a positive psychological change in the world of psychology we know as post-traumatic growth, meaning focusing on negative experience like a cancer in terms of positive framing called benefit finding and deriving strength and more adapt in positive healthy lifestyle changes. So NCI-funded large two-center trial is currently being conducted at Northwestern and Fox Chase Cancer Center. So my area of focus have been on hot flash. 2015, we published in a study in breast cancer survivors found that acupuncture compared with sham acupuncture, gabapentin as well as sham pill showed a significant improvement, and the effects was durable at 6 months from the time of randomization. I actually started this trial in prostate cancer when I was a junior faculty at UPenn, and enrolled 10 patients and found an improvement in 6 out of 10 patients with both subjective and skin conduction measure objective sweating. However, I was new and I was young. It was much harder to recruit in prostate and breast, so that's why I migrated to breast. But coming to MSK really allowed me to re-examine this opportunity because of our large prostate population. And we currently are in the analysis phase on a large trial funded by the Patient-Centered Outcome Research Institute to compare acupuncture versus cognitive behavior therapy. Is a dual-site trial randomizing 160 cancer survivors between UPenn and MSK. We finished our enrollment 3 months ahead of schedule. We have really a good, healthy proportion of the survivors are from prostate cancer, and we plan to do the over-analysis, then more focused analysis in prostate cancer. So stay tuned, probably in a year we will be able to present this data. Last but not least, putting this all together, really there's a robust evidence in the area of comprehensive lifestyle change. The work is predominantly conducted by Dean Ornish from was previously at UCSF, showing that comprehensive lifestyles, meaning stress management, physical activity, more of a plant-based diet, really help prostate cancer patients with quality of life, may even have some positive signal in affecting prostate gene expression in the tumor as well as prostate cancer progression. Last but not least, herbs is a really kind of a topic we get asked the most in integrated medicine visits. And we have this amazing sort of tool for clinicians. It's downloadable on sort of your iPhone and or Android device. So we have about 262 monographs on specific type of herbs, has both a clinician version as well as a patient version. So you could also encourage your patient to download. Today, there is about 25 million hits, and at any given day, there's about 4,000 hits from all over the world. So it will take another day to go over all the herbs, so I just want to focus on 2 potential positive supplements. One is a pomegranate tea. It's a blend of pomegranate, curcumin, green tea, and broccoli, and has some evidence in a randomized control trial to show that help to reduce the rate of PSA increase in PSA relapse patients following post-radical treatment. I mean, in our clinic, we see a lot of patients are very adamant about taking herbs, so telling them don't take anything is not going to go anywhere. But sometimes direct them to at least herbs have safety and some evidence is an easier route to go. And also flaxseed, there is some sort of animal data as well as human, at least translational data to show decreased biomarkers as well as inhibit prostate cancer cells in animal models. And a lot of patients ask, they're really into taking high doses of vitamin. Unfortunately, the evidence is really not convincing high dose of vitamin is really beneficial. In previous observational studies, there's some evidence that vitamin E or selenium has been helpful, but in large randomized controlled trials, they have been all very disappointing. Actually, the signals may pointing towards increased prostate cancer mortality and negative outcome. So the message I tell patient is taking a regular multivitamin is probably safe and potentially beneficial, but currently there's just no evidence about singular type of vitamin is harmful. Actually, in studies, a recent paper published in Lung Cancer, high-dose vitamin E is harmful for people with smoker-related lung cancer. So I typically try to say, there's a lot of hype, there's really little evidence. I would probably myself stay away from high-dose vitamin for a long time. A lot of patients treat sort of active surveillance as a sort of very kind of passive experience. They say, you know, my doctor asked me to just wait. It's so anxious to wait. I would rather to have it take it out. Like, to think about there's cancer in my body is really scary. So typically we try to frame this active surveillance is really not passive. You have a lot to do during this time. Stay physically active, actively works towards a healthy diet, actively manage stress because there's a lot of anxiety to go around in this period, and actually engage in choosing what therapies work for you in terms of managing your symptom side effect, whether it's sort of a hot flashes, fatigue, or sleep issues, or sexual dysfunction. And last but not least, there's more and more evidence that this year's Nobel Prize went into the biological clock and circadian rhythm. So unfortunately, a lot of patients, as well as healthcare providers, don't sleep well. So really develop a really restful sleep and stay a very active life. It's quite important. So thank you very much.